Essential Kids Health Tips, Preventing Typhoid Fever. Welcome to our channel dedicated to children's health and well-being. Typhoid fever is a serious bacterial infection that can affect children and lead to severe illness if left untreated. In this video, we'll explore practical tips and strategies to help parents and caregivers protect their children from typhoid fever. From hygiene practices to safe food and water consumption, join us as we discuss effective ways to safeguard your child's health and prevent the transmission of typhoid fever. Let's empower ourselves with knowledge and take proactive steps to ensure our children lead healthy and fulfilling lives. Let's get started. Hello, everyone. Today, we're addressing a critical health topic, preventing typhoid fever in children. Typhoid fever can cause serious illness and complications, but with the right precautions, we can minimize the risk for our little ones. Let's explore some essential tips to protect our children from typhoid fever. Segment 1, Understanding Typhoid Fever. Explanation of typhoid fever as a bacterial infection caused by Salmonella Typhi bacteria. Overview of common symptoms, including high fever, headache, stomach pain, weakness, and rash. Discussion on the importance of early diagnosis and treatment for typhoid fever to prevent complications such as intestinal perforation and bloodstream infections. Segment 2, Promoting Good Hygiene Practices. Teaching children proper handwashing techniques with soap and water, especially before eating and after using the toilet. Encouraging children to cover their mouth and nose when coughing or sneezing to prevent the spread of bacteria. Emphasizing the importance of personal hygiene, including regular bathing and keeping fingernails clean and trimmed. Segment 3, Safe Food and Water Consumption. Ensuring children consume safe and hygienically prepared food and drinks to prevent ingestion of contaminated food or water. Teaching children to avoid consuming raw or undercooked foods, especially meat, eggs, and seafood. Providing children with safe drinking water from treated or boiled sources to prevent waterborne infections. Segment 4, Environmental Sanitation. Promoting proper waste disposal practices, including the use of toilets and sanitary latrines to prevent contamination of soil and water sources. Encouraging community-based efforts to improve sanitation infrastructure, such as constructing sewage systems and waste management facilities. Participating in cleanup campaigns and community hygiene education programs to raise awareness about the importance of sanitation and hygiene. Segment 5, Vaccination. Highlighting the importance of typhoid vaccination for children living in endemic areas or traveling to regions with a high risk of typhoid fever transmission. Consulting healthcare providers or public health authorities for information on typhoid vaccination schedules and options for children. Ensuring children receive recommended booster doses of typhoid vaccine as per national immunization guidelines. Segment 6, Nutritious Diet. Emphasizing the importance of a balanced diet rich in vitamins, minerals, and protein to support children's immune system and resilience against infections. Providing children with nutrient-dense foods such as fruits, vegetables, whole grains, and lean proteins to promote overall health and well-being. Addressing nutritional deficiencies associated with typhoid fever through supplementation and dietary interventions, especially during recovery. Segment 7, Health Education and Awareness. Conducting health education sessions for children, parents, and caregivers on the signs, symptoms, and prevention of typhoid fever. Utilizing educational materials such as posters, pamphlets, and videos to convey key messages about hygiene, sanitation, and vaccination. Encouraging community involvement and empowerment to promote behavior change and sustainable interventions for typhoid fever control. Thank you for joining us as we explored essential tips for preventing typhoid fever in children. By following these proactive measures and promoting good hygiene practices, we can protect our children from the risks of typhoid fever and promote their health and well-being. Remember, prevention is key. Don't forget to like, share, and subscribe for more valuable content on children's health. Until next time, stay safe and healthy.